Good morning, Illini. I'm your host, Matt Schrock, here for Healthy Illini. We're glad you're with us. We're glad you're tuning in again. Today, we're continuing on a kind of a series that we've been doing, not like a regular series, but as we've gone on, we have tried to talk to some of our staff here at McKinley and talk about health careers and things you can do in the health field. And so today is another one of those opportunities to talk to a couple of our staff. I'm joined today, again, both of these women have been on our program before, but I'm joined today by our registered dietitians here as part of our health ed department at McKinley Health Center. First up, we have Bree Whitted. Bree, thanks for joining us again.
Yeah, thanks for having me.
And also Audra Cisna. Thanks for being here.
Thank you, Matt.
So you're our two dietitians here at McKinley. And like I said, we've been trying to kind of go through health careers and some opportunities that you have in the health field and explain a little bit more what it means, because we can talk about all the positions we have here at McKinley, and you can find them on our website and check it out. But just to get a little bit more of an in-depth look and kind of how you get there. And today it's about nutrition and health education specifically. Now, you're both registered dietitians, and so we're going to talk in a minute about what you can do with that kind of position, what kind of career, like with that career, what kind of positions are available out there. But in prep work, you both specifically made the distinction of being a registered dietitian versus a nutritionist. So I'm going to start there. What is the difference between a nutritionist and a registered dietitian?
So basically, anyone can really call themselves a nutritionist. And I say that all dietitians are nutritionists, but not all nutritionists are dietitians. So being a dietitian, you're really recognized as a medical professional. It's a title reserved for people who complete specific education and licensure requirements. So a nutritionist is really just like a self-proclaimed title, and there aren't really any requirements regarding who uses that title. It's a title that implies little to none really professional accreditation.
So there's not a nutritionist degree. If you
Correct.
That idea is a dietitian.
Right.
Okay.
Right.
Okay. So we're going to talk a little bit about the education because I want to get to that at some point. But so let's just talk about what a registered dietitian does. Like, you can throw that out there. I'm a registered dietitian. That's great. What does that mean? Does that mean you are, making meal plans for people? Are you studying the ingredients? What does a registered dietitian do? And then as a secondary follow-up to that, as we're talking about it, like, what are some things you can do with that type of degree?
I think it's just like with any profession, it kind of depends on what area you're working in. So you're always going to have dietitians that are kind of focused on different areas or specialize in different things. So some dietitians work in hospitals, some work in community settings, some dietitians might work in food service settings. So that might be for a school district, or like here at the University of Illinois, we have dietitians that work in campus dining. Some dietitians might work in pharmaceutical sales, like for supplement companies, patients that are hospitalized and can't eat by mouth, like they have to have some nutrition through intravenous or like through tube feeds that's fed into their stomach. So, that's a component. Some dietitians kind of specialize in that type of area of nutrition. A big thing lately is like entrepreneur type focuses, where some dietitians might go out on their own and do like private practice. So it kind of depends on what area you're in, like where your focus is going to be.
But there's a pretty wide variety.
Very.
The spectrum is pretty big on where you can land as an RD. Yes. Do that sort of thing. So let's talk about what you do here at McKinley, since we're talking about McKinley and we're talking about health careers, but also what happens here at McKinley. What do you do as a registered dietitian here? How do you help our student body here at UIUC?
So I think the biggest thing to know, too, is that in all of these different sectors of being a dietitian, we are the ones that can provide medical nutrition therapy. And so Bree and I do that on an outpatient counseling basis. So any type of student or any student here at U of I can come and see us for any type of concern that they have regarding their health and nutrition specifically. Those things go hand in hand. So any disease process, whether it's high cholesterol, diabetes management, weight loss or weight gain even, or even just establishing like healthy relationships with food. They can schedule an appointment and meet with us, and we can work through some of those avenues that they might need assistance with in terms of creating different meal plans, or even just, counseling, therapy type of situation in terms of nutrition specifically.
And that's a big thing, because throughout my adult life, there's been moments where I'm like, I need to eat better. I need to, find a better exercise routine. I need to find a better diet, that kind of thing. And it's really hard sometimes to find something that works for me, because it might work for somebody else. And it's so individualized. Mm-hmm. And so it's really nice that we have an opportunity to provide to students that they can do that one-on-one and get that individual. Because there are some overall ideas, obviously, that work for everybody. But it's really nice to have that someone to talk to and say, this is what I'm dealing with, this is my budget, this is my food availability, these are my food allergies, things like that, and find some support and some guidance on how to adjust to whatever needs to be adjusted. And that's really what you guys do a lot of. And so it's really, I'm very proud to have this program as part of McKinley and to be associated with it, because I think it's really such a valuable thing for students. And we talk a lot about the decisions you make as a student, as a university student, will influence how you live your life. Like if you get into an exercise routine, it's easier to maintain later on. If you get into a good diet, it's easier to maintain later on. It's harder to make that change if 10 years down the road, case study in that, it's hard to make that change if you've kind of neglected it for 10 years and then decide, oh, hey, I need to figure out what eat better now because my metabolism has slowed down. So it's nice to have that opportunity to have students meet with you and get that kickstart, basically. So if somebody's listening and they say, that sounds really interesting, I want to know more about it. What you talked to Audrey, you talked about the licensure and the training and things like going to that. What does it take to become an RD? What's the schooling involved in that?
So as of January 1st of this year, it has become a requirement to obtain a master's degree. So a master's degree is now required. Once you complete your schooling, then you also have to complete 1,200 hours of supervised practice through a dietetic internship. Once that internship has been completed, you're eligible to sit for your boards. After completion of that, then, and all of your fees are paid to all the accrediting agencies, then you can use the title Registered Dietitian Nutritionist.
Do you have ongoing education? Is there an hour number that you have to have? Is that 1,200 hours? Does that continue on yearly, or what's your continuing ed requirement to maintain?
Yeah, we have to have 75 hours every 5 years.
That's not too bad. So we talked about the master's side of it, but something that we don't often talk about when we talk about degrees, no matter what it is the personality, mental aspect of it. When I hear registered dietitian, does that mean I have to be a health nut? I'm using that very carefully because I'm not trying to be derogatory or anything, but my eating habits aren't great. I've never been someone like that. Is that something that is really, is there a certain particular mindset that dietitians, or do you find that as you meet people that it's kind of all over the place, all over the board as well?
As far as a student that wants to study
as far
nutrition?
as someone who becomes an RD, is there kind of a similar mindset across the other dietitians you've met, or do you find that it's kind of it's a rainbow of people?
I definitely say there's a rainbow, but we've often talked about how easily we can relate to other dietitians. Like if there's another dietitian in the room, we automatically have a connection, because a lot of times you're going to have similar traits. But no, you don't have to be a health nut by any means, because people get into this for different reasons. There's different driving forces behind it. Whether I think I've talked on other podcasts about how my interest in nutrition kind of came from a personal interest, and how I noticed when I ate better, more balanced, actually ate food and had energy to perform in athletics, that kind of inspired me to learn more about it. but some individuals get into it because they love the cooking side of it, or they love the research side of it.
I think that's really important to highlight that, because for me, and again, I'm coming from my own personal experience, a dietitian is kind of the same thing as like a personal trainer or like going to the gym. It's like, you know, there's a stigma around that idea. Well, I'm not that kind of person, or I don't look that kind of way, that kind of thing. And so I think just, you know, talking about how it's for everybody and there's different aspects to it and there's different personalities that come into it really opens the door for some, to make it personal, to make it accessible, and to make it not quite so daunting to walk into somebody's office and you know, especially when you know that there needs to be improvement there, that something needs to change, that can be a hard thing. And so having that idea that it's a wide variety of reasons and a wide variety of personalities, I think that opens the door a little bit more on that. So we've talked a little bit about the different kinds of jobs you have as a registered dietitian, and both of you had worked elsewhere before you came to McKinley. So would you share a little bit about your background, kind of from a workplace standpoint, of where you've been and kind of before you came to McKinley? Because again, one of the things that we try to highlight in this series is that we see people and we put them in a little box. Like I see the cashier at my grocery store, and that's who they are. They're the cashier. They don't live in that stall, that till. They have other things going on. That's not the only job they've ever had for a lot of them. But in my mind, they're the cashier. They sit right here. And so trying to give a more well-rounded personal view of our staff to kind of, again, make it, you know, personal and accessible and that sort of thing. Where did you work before you came to McKinley?
So I kind of started out in the outpatient world and worked at like a health fitness center, and saw clients, you know, for one-on-one basis, and did some programming like outreach, you know, lecture, seminar type things. I think the important thing to remember is that your career can change like based on your stage of life. So my stage of life, like after that, kind of changed a little bit, and I had small children and I needed something that was a little bit more consistent as far as like schedule goes. So I worked in the hospital setting for 10 years as a clinical dietitian, and that was like when I was doing my internship, my undergraduate work, that was the last place I was going to end up. But I really enjoyed my time there. I liked the acuity of the hospital and the fact that I could actually see how nutrition, lack thereof or excess of, kind of like affected individuals' health. And so I stayed there longer than I thought I would. But again, stage of life kind of changed. And as my kids grew, there was just kind of like a drive to do something different. And so I changed and came here. I was a student here many years ago, did my undergraduate work here. And so it was really intriguing to me to kind of come back on the other side of the tracks. And I didn't learn about the services, like that there was even a dietitian on campus, till I was like almost on my way out. So it was really cool to come back into that role. Yeah.
So right out of my dietetic internship, I was hired with the hospital I interned with. So I was an inpatient clinical dietitian for about a year. And then for 5 years, I worked as a consultant dietitian with a company based outside of Chicago. I've been born and raised in Central Illinois. So just because I was employed, you know, in the Chicago area, they covered facilities throughout the state of Illinois. So I covered long-term care, so nursing homes, assisted living, group homes, and then I also covered a dialysis center. So my range was all as far north as Paxton, Illinois, to as far south as about Effingham, and then Danville and Decatur in between. So it was a great experience. It was very clinical oriented, just like the hospital. And then, like Bree was saying, stage of life, changes. And we had a 2-year-old daughter at home, and, my minimum 8-hour work day was really like a 10-hour day being away from home, and just that traveling was not very conducive to having little children. So I was approached by a fellow dietitian that I went to undergrad with, and I worked with an independent physician specializing in bariatrics, and I was with them for the last 10 years. So that was a very, very family-friendly type of position, great hours, very close to home. Having that home base was good for our family. And then, things change, and retirement on the outlook, for the physician I worked with was upcoming. And so I knew it was time to change for myself. And the potential for growth, that was another thing. Because we were an independent practice, where there were less than 10 of us running this surgery center, which was awesome. But I was the dietitian, and I knew there wasn't any growth possibility. So that's when I came across Bree again, and saw that there was a job opening here at McKinley, and made that transition just in August.
And just those two paths show so much variety in how the jobs you did, the way they were done, shows exactly the spectrum of what can be done with an RD. So you can see it right there, just in two individual stories, how much opportunity is out there. But you both talked a little bit about stage of life, and the last thing I want to talk about today with you is, again, we try and give the personal side of our staff, kind of show who you are outside of work, because you're both registered dietitians, but that's not the entirety of your being. So you talked about families and things like that. So I wanted to ask you, and kind of give you a chance to share with any listeners, especially students, whatever you're comfortable sharing, but kind of talk a little bit about who you are outside of the job. So what are some things that you enjoy doing? What are some things that, some hobbies and things like that you do out when you're not at McKinley?
So I have 2 boys. They are, 12 as of yesterday, one of them, and then 7. And so they are very into sports. So a lot of my free time is spent on the bleachers, on the sidelines. My eyes might be closed because I'm sitting there praying that no one gets hurt, even though I hope it's a great experience for them. If you have kids, you get it. If you don't yet, someday you will. But I just want them to enjoy it. So we are very sports heavy family. I enjoy, teaching them about food and nutrition and how that can impact their performance in sports or their performance in school. And after working with students, I want my kids to know how to cook a few things when they go to college and not start from nothing. Things I enjoy personally, aside from watching my kids, I've mentioned this in every podcast, but I love to run. It's kind of like my outlet. It's my place of worship sometimes, where I can just kind of be with myself. I enjoy reading. Sometimes it has to be done in the version of audiobooks though, because by the time I sit down at night, I can barely keep my eyes open to read the book. As a family, we enjoy hiking, doing things outdoors. I'm still working on my skills of catching a baseball. My kids said I need some practice on the football skills as well.
What about you, Audra?
Yeah, so my family is very similar to Bree's. I also have a 12-year-old and 7-year-old twins at home. So they are very much becoming more involved with athletics, and I love to see that growth within them, advancing their skills and seeing them succeed. Our 12-year-old is now into the travel team softball, so we're going all over the place with her. But she loves it, and that's what she wants to do. And so if that makes her happy, then that makes us happy. The little ones are still not quite as involved, but rec league things within our town, summers, soccer, that type of thing. I also love to exercise. I'm not much of a runner. I've done a couple half marathons, but nothing like Bree. But I would love to spend more time in the gym. Weightlifting is a huge component of health for me. I like to focus my time there. I also love to read. I just completed my first audiobook, thanks to Bree's suggestion, which was good. But there's nothing like having a book in my hand. I think I prefer that over even the Kindle. Like, I want the book. I want to turn the pages myself. I love to read. Other than that, like, my family just loves summertime, swimming. Being with family is really, really important to us. And so whenever we can, we take road trips to visit my sister, in northern Illinois, or aunts and uncles from various states too.
I've heard the stories from both of you on your kids' athletics, so that I was waiting to hear those again. And as somebody who had a daughter now in college who did travel sports, I know that grind very, very well. It's been very strange this winter and spring not being on a sideline watching volleyball. But
we can send you some schedules if you want.
Yeah, I think I'm okay. I think I'm okay. But it is, again, it's there's an aspect of who we are in the building and who we are out of the building, and we like to try and highlight that because there is so much that goes into what we do in our jobs that's influenced by who we are in our personal lives as well.
And I think that's a big part of nutrition too, that like we were in this stage of life at one point, and different stages of life like make us relatable to others. And
you're right. That's one of the reasons that most of us on campus are working on campus, because we were at that stage of college student, and we remember those days, and we remember thinking, I wish I would have known. And so that's what we're trying to do, is trying to share some of that knowledge, some of that experience, and be a support in that, because we care about our students, and we love this period in their lives, and we want to be the support and be the people that we may have wished we had, or that we did have, and trying to, our heroes, so to speak. But yeah, who we are as a whole influences so much of what we do on this campus.
We do love to work with students, and that was one thing that was a passion of mine, is like when I was in school, I promised myself that I would help any student someday that wanted that opportunity. So if there are students on campus that are studying nutrition, we have students that work under us, in the graduate realm, but also in the undergraduate field.
Well, I really appreciate you both taking the time today to share a little bit about what a registered dietitian is, give us a little bit about some of the clarity on that and some opportunity with that, and then who you are. So Audra, Bree, thank you so much for joining us today.
Thanks for having us.
If you have any questions about any of that, be sure to check out the bio on this episode, because we'll have links for obviously McKinley, but also for the nutrition peers and for health ed and things that if you have questions, you can contact us, and we'd be happy to share more information on that. Because I know we filled 20 minutes on this today, but we could talk. Yeah, you both could talk about nutrition for hours. I know that it's a passion that you have, so I appreciate you taking that time and just sharing a little bit in this short window that we had today. As you're on campus, we've talked about it, that there are so many things that we do in our lives as students that will affect the next 20, 25 years, and not just in the career you choose, but also in the habits that you develop, whether it be nutrition, diet, how you time management, stress management, all those types of things. And if you're on campus and you're trying to figure out how to set up some of that dietary routine to find out more information, or you just have a need, you have questions, whatever it may be, contact our health ed department, talk to our registered dietitians. They'd love to sit down with you and work with you wherever you are. Or even if you have questions about how to become a registered dietitian, contact them. They'd be happy to talk to you about their path and give some advice on that as well, because that's what we're here for. Everybody on this campus is here to help students, especially here at McKinley. We want to help students become the best they can be while on campus, but also in the future. So if you have any questions, feel free to contact us. If you have comments, if you have suggestions on episodes, you like this episode, you want to give some feedback, please contact us. Let us know here at McKinley Healthy Illini. We would be happy to have that conversation with you and see where you are and just to hear your vantage point on things. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.